Dear friends, I think I have known Professor Rajan from 1979. I joined the Department of Gastroenterology on September 23rd, 1979, after spending 2 years in neurology at Sri Chitra Institute of Medical Sciences. I was fascinated by gastroenterology by Professor Balakrishnan. He used to visit his younger brother, who was my neighbor in the twin house in Chalakudi. So always his younger brother used to tell me, why don't you move to gastroenterology rather than remaining in Sri Chitra as a lecturer in neurology, and then I appeared for the PSC. Three of you in the PSC from that list, myself, Professor Thangappan and Dr. Meenu Haren, who is no more. So when I joined department in 1979, our first DM was to start a DM gastroenterology. And Professor Balakrishnan sir was moving the file, and he handed over the file to me and told, you go to the secretariat and get it passed very quickly. Within 6 months we had the DM gastroenterology. 1980, April I joined the DM gastroenterology. We had combined a teaching program with the Professor Rajan. Every afternoon at 2 to 3 we used to have a journal club, a case discussion, and we used to have a topic presentation. I was the only DM at that time. And in all the sessions, Professor Rajan used to come, and we used to have a cup of tea at the end of the session. Sometimes it goes up to 4. And I vividly remember the great contribution of Professor Rajan. I had my project on tropical pancreatitis to see whether there is a viral or mycoplasma as an etiology, supported by ICMR. The first project I wrote was in 1980. And for that project I had to get biopsies from the pancreas and look for viral culture. Take the pancreatic juice for viral culture, throat swabs, and that was collaboration with Sri Chitra. Dr. Shanmugam was a close friend of mine. And Professor Rajan used to call me morning that today we have a pancreas, please come to the theatre. So I must tell you that in the first year of the research, I did 54 pancreatic biopsies looking for viral etiology, pancreatic juice, and every theatre day I used to be in the theatre with him. As a surgeon, I learned a lot from him. We had a GI bleed and nothing was there except a Sengstake and Blackmore tube. And when the bleed was not controlled, I will call him and he will come. We used to do all sorts of surgeries, starting from Borima Kreitz, Hassab's procedure, and devascularization of stomach. Anything you mention in the literature, I used to be in the theatre with him, try to get blood. There was no donors. We used to get the donors, bleed them and get the whole blood. There is no blood bank medical officer at night. So my experience with Professor Rajan for 2 years as a DM trainee was highly motivational one, and I learned the whole surgical procedures of pancreas from him, starting from what Professor Narendranathan mentioned, the lateral pancreatectomy, the Pustos, the dual procedure, and then head coring, everything I learned from that great teacher. I think when I look back, I think the experience of Professor Rajan during the 1981 gastro meeting, the photos which you see, this is the photo of 1981 when we used to have the first gastroenterology meeting in Thiruvananthapuram, the 22nd IST. You could see here 4 people. Along the last one is myself with a white coat. The next one is Harold Fallon from US. He was the president of the American Association for Gastroenterology. His son is Junior Fallon. He is still working. Then you see Dr. Meenu Haren, who is smiling, no more with us. Dr. Nandini Kumar, who was one of our medical officers. Now later she became the Deputy Director General of ICMR retired from her service. She is bereaved. Few days ago she lost her husband. And then you see Professor Balakrishnan. So we used to work like a single department. And many a time we thought that we should admit together in one ward rather than two wards, and we had that important concept. I think Professor Ananda Kumar is also here, and subsequently Dr. Matthew Koshi joined, and then Dr. Subbalal. I think learning surgical gastroenterology and my interest in tropical pancreatitis, so also my mentor, Professor Narendranathan. He did mention about the 22 cases which Professor Rajan presented. Actually, the presentation was in the Royal College of Surgeons in London. And then subsequently, Professor Narendranathan published his first paper, the first abstract in the Indian Journal of Gastroenterology. Tropical pancreatitis is a pre-malignant condition. And that is the first paper which made that 9% of the people develop a pancreatic malignancy. And subsequently, many people took over that field. So to me, Professor Rajan was very kind, and I used to visit his house very often when Ramesh Rajan was very young. He was actually, when I used to visit him, he was in the 7th or 8th standard, and his mother used to be very fond of our family, and we used to visit him. And then subsequently, when Rajan was in Manipal, I visited him in Manipal, and I think a great leader who set up a good department, and that department produced some of the greatest surgeons in Kerala or across India. I see many of you here who have been trained in Trivandrum. I think we have gone a long way. 50 years of gastroenterology, surgical gastro first and medical gastro will come very in the next few months. And we are very thankful to Dr. Ramesh. I was not very sure whether I will be able to join. So I came all the way from Gokulam. I took a taxi and came so that I could be for this function, and I have to go back. So I am very thankful to you and your team, and to your family, your mother and your father, who have been very kind. And when we lost both of them, we could come and meet with you all. And Ramesh Rajan is a good friend of one of my mentors, Dr. Guru Prasad Aital from Manipal, who knew Ramesh's younger brother. He is, I told, his classmate, and always he used to ask me, how is Rajan's son? So to you all, best wishes, take the department forward, come to higher heights, and we are always helpful to you, and we thank you for the appreciation for the Department of Medical Gastroenterology, and together we could do it, and we are still an unbeaten force in Kerala. Thank you.